The World Health Organization has declared a global public health emergency following an outbreak of the Mpox virus in Africa. The WHO had been monitoring a surge in cases in the Congo. The new variant has spread to Burundi, Kenya, Rwanda and Uganda. The infection can be passed on through close contact. It causes flu-like symptoms and lesions on the body. The head of the WHO says the alert is necessary to save lives.
Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. It's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law.
Well, Rimoin is an expert on infectious diseases, professor of epidemiology at the UCLA Fielding School of Public Health. This brings us all back to the pandemic and the last outbreak of Mpox in 2022. How is this outbreak different, first of all?
Well, thanks for having me. And that's a very good question. I think when we think of these public health emergencies of international concern, sometimes we think of what's happened before. We think of COVID-19, of course, but more importantly, in this scenario, you should be thinking of the global outbreak of Mpox that occurred in 2022. What we saw then was monkeypox virus, or now what we call Mpox, spreading in a way that we had never seen it spread before, and spreading in new places where it had not been previously spreading. We're seeing a similar phenomenon, but this is a very different, this is the other clade or the other strain of Mpox. And we're seeing a similar phenomenon here. We're seeing it spread in unprecedented ways. And so that's why the WHO committee has advised the Director General to call a public health emergency. And similarly, the Africa CDC has called an emergency of regional concern.
Mm-hmm. I believe children are most affected. Is that correct? So what precautions should people be taking?
Correct. What we've seen in the Democratic Republic of Congo is that we've seen a steady increase over the last many years of Mpox. Some of this was anticipated as we continued to see reduction in number of people who had any kind of protective immunity against pox viruses due to smallpox vaccine. But this was much greater than what would have been anticipated. But in addition to that, we are also seeing sexual transmission in a variety of communities, both in sexual and gender minorities, also in people who are selling sex as well. So we're seeing this spread in different ways. So it's almost like there are two different outbreaks that are occurring at the same time, but by and large, what we're seeing is Mpox spreading in a way that has not been seen previously.
Wow. How will this global alert from the WHO actually help fight off the disease in some way?
This is actually a very important moment and really demonstrates that we've learned a lot from previous outbreaks or previous situations. You know, we've in the past maybe reacted a little more slowly when we see something happening in remote rural areas in Africa. But I think what we've learned here is that an infection anywhere is potentially an infection everywhere. And what's happening in rural areas of Africa can very easily come to our doorsteps anywhere in the world. And so being able to stop this at its source as soon as possible is critically important. And this public health emergency will do many things. It will unlock funding that has not been available to really support surveillance, better testing opportunities, more efforts towards public health, but it's also going to help coordinate getting vaccines and therapeutics to these areas that have not had these tools to be able to combat Mpox previously.
And just briefly, you mentioned this is an important moment. What are the chances of this being cut off from spreading even further than it has already spread?
Well, it's going to be very important to be able to track it. And obviously, when we're talking about a virus like monkeypox, it is something that spreads through sexual networks very easily. And we saw that with the global outbreak in 2022. This variant, there are a lot of questions around it. Traditionally, we thought this was a variant that might be create more severe disease, might be responsible for more deaths. We still need to study it to truly understand it, but it is possible that it could be a more serious variant. And so what we need to know is that we're dealing with a situation similar to what we saw in 2022. We can get in front of it with good information, with the tools that we have available, and it's not a moment too soon.
Fantastic. There's some good news in that from Anne Rimoin from the UCLA Fielding School of Public Health. Thank you.
Thanks for having me.